infection that affects the lungs. It is not an uncommon one and it can affect any age group. It can become life-threatening condition if timely treatment is not given. Pneumonia symptoms can be obvious and be similar to that of the usual flu, but at times people may get confused thinking it's some other infection. So today, let me discuss in detail about pneumonia causes, pneumonia symptoms, pneumonia complications and pneumonia treatment. Before we actually get into the pneumonia causes and pneumonia symptoms, let me tell you what happens here in pneumonia. Our respiratory system is made up of tube-like structures called bronchi and bronchioles. These structures end up in balloon-like sacs called alveoli. Pneumonia is a disease of these balloon-like structures called alveoli. Under normal circumstances, tiny amount of fluid is present in these alveoli. But when these alveoli are inflamed or infected, fluid or pus gets accumulated. This will hamper exchange of oxygen and carbon dioxide, leading to pneumonia symptoms. Coming to pneumonia causes, it can be either due to an infection or some chemical or substance that irritates the alveolar lining. Bacteria like Streptococcus, Haemophilus, Mycoplasma, viruses like flu, COVID-19, rotavirus, fungus like Histoplasma, Pneumocystis are the common causes of pneumonia. While amongst these, bacteria are the most common causes of pneumonia. In certain types of viral pneumonias, symptoms tend to be very mild. Fungal pneumonias do not happen in a normal healthy individual. They usually happen in someone who has chronic medical conditions or has a compromised immune system. While these are the organisms that cause pneumonia, there is another different type and not so common, that is aspiration pneumonia. When food particles accidentally enter the lungs, they cause irritation of the lining, and also bacteria from the throat is carried into the lungs, which can lead to pneumonia. Another type is called chemical pneumonitis or chemical pneumonia. This is due to inhalation of gases like chlorine gas or pesticide fumes. What are the pneumonia symptoms? Pneumonia symptoms can range from mild that you wouldn't even notice them to severe life-threatening. And pneumonia symptoms can develop abruptly or gradually. These include high-grade fever, and the temperature can go up to 105 degrees Fahrenheit. There can be associated chills, shivering, rigor, loss of appetite, increased heart rate, increased breathing rate, loss of energy, fatigue, profuse sweating. Diarrhea, nausea and vomiting are often seen in children, and in elderly people, symptoms like confusion and low temperatures are also seen. One of the common pneumonia symptoms is cough. It can be dry or associated with sputum that can be of white or yellow or green or black or rusty color. In viral pneumonia, for the first couple of days, there can be flu-like symptoms which include headache, malaise and body pains. In severe cases, pneumonia signs and symptoms include bluish discoloration of lips and fingertips, fainting episodes, confusion and disorientation. Pneumonia treatment. When you are exhibiting pneumonia symptoms, you will be asked for your medical history and also physical examination, including examination of your chest for breath sounds will be done. Investigations like blood tests, chest x-ray, sputum test, and in some cases CT scan and bronchoscopy are also done. Pneumonia treatment depends on age, severity, type of pneumonia and associated medical conditions. If it's a bacterial pneumonia, antibiotics are given. If it's a viral pneumonia, antivirals are given. Along with these medications, fever meds like paracetamol, avoiding smoke, hydration, drinking warm fluids and taking warm food, plenty of rest can help in relieving the symptoms. In severe cases, oxygen therapy and ventilator support may be given. What are the pneumonia complications? Like I mentioned before, if pneumonia treatment is not administered within time, it can lead to severe complications, and these include sepsis. The organism can enter the bloodstream and can affect multiple organs, leading to multi-organ failure. ARDS and respiratory failure, where there is severe compromise in lung functions, and this may require ventilator or breathing machine support. Lung abscess, pus-filled cavities will be formed inside the lungs, and pleural effusion. Fluid can accumulate outside the lungs, and this will limit the lung expansion and also the breathing capacity. Either it's a mild pneumonia or a severe one. One has to consult a doctor and get treated accordingly. Most often, cough medications or syrups are taken over the counter to suppress the cough. Remember, without doctor's advice, do not take these cough medications because cough is a protective reflex and can actually help in recovery. It takes a while to recover completely from pneumonia, so don't rush to recovery. If you or someone in your family is experiencing flu-like symptoms, or you're worried that you might have pneumonia or have COVID or viral infection, get in touch with a doctor right away. We are always here to help you. Stay safe, take care.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.